Today we will discuss about the histology of stomach. Okay, next part of the GI tract. So first we will discuss some basic things of GI tract. So gastrointestinal tract, it is a long mucomuscular tube that extends from the proximal part of esophagus to the distal part of anal canal, and it includes the esophagus, stomach, duodenum, ileum, jejunum, colon, vermiform appendix and the anal canal. Okay, and essential for it is these are the functions. It is essential for digestion, absorption and transport of the food material. Okay, these are the four basic layers from inside outward for the gastrointestinal tract. First, innermost is the mucosa. This one is the mucosa. It consists of these three layers. First is the lining epithelium, then lamina propria, which is loose areolar connective tissue, and then the muscularis mucosa. Okay, a small layer of muscle. Next is submucosa. Beneath this muscularis mucosa, here is the submucosa. Submucosa is also a loose connective tissue layer. Okay, some adipose tissue, sections of blood vessels you will also get in this layer, and sections of glands in some cases they are present. Okay, next is muscularis externa. This one is muscularis externa. It consists of two layers, inner circular layer and outer longitudinal layer. Okay, and outermost is the serosa or adventitia. Serosa, where peritoneum is present. Peritoneum is covering the organ. Here you will say serosa. In other parts you will see adventitia. Okay, that is the difference. Component of tissues are almost same, loose connective tissue layer, but they are named like this. Okay, where there is peritoneum is present, it is named as serosa. In the other part, it is named as the adventitia. Okay. So these are the layers from inside outward. This is mucus associated lymphoid tissue just beneath the mucosa. It is present, epithelium, lamina propria, muscularis mucosa. Then there is the submucosa. Submucosa are glands, nerves, vessels, you will see. Then after that, muscularis externa, inner circular layer, outer longitudinal layer, and outermost is the serosa. This is peritoneum covering. Okay, mesentery is enclosing the gut tube. So mucosa consists of three layers: lining epithelium, lamina propria and muscularis mucosa. And lining epithelium, here the gut is lined by simple columnar epithelium, except as these regions, except in esophagus, which is lined by stratified squamous non-keratinized epithelium, and terminal part of anal canal, it is also lined by stratified squamous non-keratinized epithelium. Okay, and the major functions of the epithelium are protection, absorption and secretion. And the absorptive function of the gut, it is supported by a large surface area because of presence of different folds, and the villi, microvilli, all these are increasing the surface area. Okay, acha ei fan ta ekটু chala তোরা. Next is to increase the surface area, intestine shows following modifications, especially in the small intestine. These are the modifications. First is plica circularis. These are circular folds. Next is the villi and the microvilli. So other than these three modifications, the length of the intestine and crypts are the depressions of the epithelium in the lamina propria, also increases the absorptive power of the intestine. And the intestine also performs secretory function that provides lubrication factors, digestive enzymes and even antibodies. The secretory function of intestine is supported by unicellular secretory cells of lining epithelium of gut, simple tubular glands, some mucosal glands and the extramural glands. Glands are located in different positions. Next we are going to lamina propria. All these layers, components will be same. Okay, some variations will be there according to duodenum, jejunum, ileum or stomach. Some variations you will see, but rest of the part will be same. Okay, so you have to know the variations. First you know the basic things, then know the variations. Okay, so next we are going to lamina propria. It is the layer of loose connective tissue that supports the epithelium, and it consists of blood vessels and lymphatic vessels, and these vessels help in the transport of the absorbed nutrients. Lamina propria has GALT, gut associated lymphatic tissue, okay, in the form of diffuse lymphatic tissue and lymphatic nodules. And the GALT play a major role in protection, phagocytosis and antibody secretion. In the ileum, the lymphatic nodules occupy the lamina propria and some mucosa to form the Peyer's patches. This is important feature of the ileum, okay, Peyer's patches. Next is Muscularis mucosa. Muscularis mucosa is the smooth muscle cell layer that separates the mucosa from the submucosa, and the muscle cells are arranged in two layers, inner circular, outer longitudinal layers. And contractions of muscularis mucosa can change the shape of the mucosa, and it facilitates the absorption and secretion. Okay. Next, we are going to submucosa. It is a loose areolar connective tissue layer, contains numerous blood vessels, lymphatics, and occasional glands in the esophagus and duodenum, and it shows few unmyelinated nerve fibers and ganglionic cells that forms the submucosal Meissner's plexus, and it allows the movement of mucosa over the muscularis externa. Next, we are going to Muscularis externa. It consists of smooth muscles arranged in two layers, inner circular, outer longitudinal layer. The exceptions for this arrangements are these. Upper one-third of esophagus has striated muscles, middle one-third of esophagus has both striated and smooth muscles, and stomach has three layers of muscle layer. Inner oblique, this is added layer. Next there will be circular, and outermost is the longitudinal. Okay, so this is one extra muscle layer is added for stomach. And in large intestine or colon, the longitudinal fibers form prominent bundles. These are called tinea coli. We will discuss during large intestine. In some parts, the circular muscle layer forms a thick band that works as sphincter or valves. And for example, pharyngoesophageal sphincter, part of the cricopharyngeus muscle, lower esophageal sphincter, pyloric sphincter, ileocecal valve, and internal anal sphincter. All these are formed by thickening of the circular muscle layer. And in between the inner circular and outer longitudinal layers, Auerbach's plexus or myenteric plexus is present. And what is the function of muscle layer? It propels the content of the intestine with the help of peristalsis. Okay. Next, we are going to Serosa or Adventitia. It is the outermost connective tissue covering of the intestine. And if the intestine is covered by a layer of peritoneum, that is mesothelium, simple squamous epithelium, the covering layer is called as serosa. And if the intestine is covered only by connective tissue, the covering layer is called adventitia. Okay? And large blood vessels, lymphatics and nerves traverse through this serosa to supply the other layers. So this is the summary of the layers. First is mucosa. It is formed by these three layers: epithelial lining, lamina propria, and muscularis mucosa. And some mucosa consist of loose areolar connective tissue, and some mucosal nerve plexus is present, that is Meissner's plexus. Then there will be muscularis externa. It is formed by smooth muscles, inner circular layer, outer longitudinal layer. And then there will be adventitia or serosa, outermost. This is a connective tissue layer. Serosa is covered by simple squamous epithelium of the peritoneum. Okay, so these are the four layers of the GIT. So, stomach. So, stomach is a hollow. This is gross features. Gross features we will discuss. After that, we will go to the histological picture. Okay. So stomach is a hollow muscular organ. See this is stomach that lies between the esophagus and the duodenum. And anatomically, it has a fundus body, pyloric part, and cardiac end and pyloric, two ends, cardiac end and pyloric end. So this is fundus body and this is pyloric region. Okay, and two ends are the cardiac end and pyloric end. And histologically, the stomach shows three regions: cardiac region, fundic region, and pyloric region. Okay, histologically, in these three areas, some variations are present. So, histologically, stomach shows usually four layers of the gut, that is mucosa, submucosa, muscularis externa, and serosa. And gastric mucosa shows presence of gastric glands. See, this is the location of the stomach. This part is cardiac region, fundus, body, pyloric region. Okay, it is closely related to liver, gallbladder. This is lesser omentum. On this side, greater omentum. Okay. So these are the basic structure of the mucous membrane of the stomach. There is gastric pits. Okay, gastric pits are receiving the secretion of the gastric glands, and these are embedded within the lamina propria. Okay, so this is surface epithelium, mucosa. Surface epithelium is simple tubular type of epithelium, and there will be invaginations from the epithelium, and these are known as gastric pits. These are the openings of the gastric pits embedded within the mucosa. Okay, so this is epithelium, this is lamina propria, this is muscularis mucosa. After that, there will be submucosa. These are the location of gastric glands. So these are the glands. Glands are opening into these gastric pits. Okay. Here also you can see opening of some pits. Epithelium, lamina propria, muscularis mucosa, submucosa. These three are together forming the mucosa. So there are some rugae. It gross feature. If you cut the stomach longitudinally, here it has been cut, you see some folds. These folds you can see, these are known as gastric rugae. Gastric rugae or gastric folds. Okay. In cancer of the stomach, these rugae will be absent. Okay. So rugae, the gastric folds are coiled sections of tissue that exist in the mucosal and submucosal layers of the stomach, and they provide elasticity by allowing the stomach to expand when a food bolus enters the stomach. Okay, it is antero-posteriorly flattened generally. When you take food and water, it will be distended. So these folds will vanish when it is distended. Okay. Next, there is gastric pits. You have seen gastric pits are opening in the epithelium, from where invagination of the epithelium occurring. Gastric canals along the lesser curvature of stomach, where innermost oblique layer of smooth muscle fibers are absent. See, this part is the lesser curvature. This is greater curvature. Along this lesser curvature, a depression is present, that is known as gastric canals. Liquid is directly passing through this canal into the duodenum. Okay, and solid food is entering in this area, fundus body, pylorus, and it will be crushed into small pieces and further digested by the gastric juice. Then there is a mucus coating or visible mucus. This protects the epithelium, this mucus coating. That is very important. If it becomes absent, there will be ulcer formation, okay, gastric ulcer. So we will discuss the individual regions. First is the cardiac region of stomach. A section of stomach in the cardiac region shows those four layers: mucosa, submucosa, muscularis externa, serosa. Mucosa of cardiac region shows three layers: epithelium, lamina propria, muscularis mucosa. Lining epithelium, here will be the simple columnar epithelium with basal oval nuclei, and the epithelial cells secrete mucus and hence also called the mucous surface cells. And these cells show vacuolated cytoplasm as mucus is washed during the slide preparation. Okay, and there are no goblet cells in the stomach. Next, there will be lamina propria. Lamina propria contains mucus-secreting simple tubular cardiac glands. Okay, and these glands are lined by simple columnar epithelium with flattened basal nuclei. Apical cytoplasm of these cells is filled with mucin granules and may show vacuolated appearance on HA staining. Duct of cardiac glands open at the gastric pits. Okay, you have seen already. Next is Muscularis mucosa. It consists of smooth muscle cells arranged in inner circular, outer longitudinal. Okay, thin layer, but two layers are present. Next is Submucosa. Submucosa consists of loose areolar connective tissue. It has blood vessels, nerve fibers, and submucosal nerve plexus, Meissner's plexus. Next is Muscularis externa. The smooth muscles of stomach are arranged as outer longitudinal, middle circular, inner oblique. Okay, some new concept have developed recently. As a histologically distinct layers of Muscularis externa cannot be differentiated. So, smooth muscle of Muscularis externa are oriented randomly. Okay. Next is here one nerve plexus is present, myenteric or Auerbach's plexus. It is present between the bundles of smooth muscle fibers. Okay, mainly between this inner circular outer longitudinal layer. Okay, this myenteric or Auerbach plexus is present. Next is serosa. It is covered by connective tissue layer with mesothelial lining of visceral peritoneum. And along the lesser and greater curvature, peritoneum continues at lesser and greater omentum, gastrosplenic and gastrophrenic ligaments. Okay, these are important ligaments of stomach. You will see viscera of stomach also. During that, you see the ligaments. So, cardiac part of stomach, mucosa, submucosa, muscularis externa, serosa. Mucosa, these three layers. Epithelium is surface mucus cells, columnar cells with vacuolated cytoplasm and basal oval nuclei. Lamina propria contains simple tubular glands which secrete mucus. This function is important for stomach. Next is muscularis mucosa, same as other. So this is schematic presentation. This is gastroesophageal junction, cardiac end. See, this is stratified squamous non-keratinized epithelium. After that, columnar epithelium has begun. Okay, and from here some invaginations. These are the gastric pits. Okay, and after that lamina propria, and these are the gastric glands, section of the gastric glands. And here is the muscularis mucosa, then here is the submucosa containing some sections of blood vessels and adipocytes like this, and this is muscular layer. Okay, innermost oblique, inner circular, outer longitudinal like this, and outermost will be the serosa. And see here, their changes of epithelium is occurring abruptly from stratified squamous non-keratinized to columnar. Okay, simple columnar. Not here, no gradual change is occurring, but in respiratory tract, gradual change occurs. Okay. Hello. Hello, class है आज परे कुछ. Okay, so these are the identification points of this region. This is asked in your viva whether abrupt change occurs or gradual change. Okay, abrupt change occurs here. Important for viva and MCQs. Next is these are the four layers you have already seen. So already discussed these parts. So this is diagram from the histology atlas. You can see the abrupt change at the gastroesophageal junction. Okay, from stratified squamous non-keratinized epithelium to simple columnar epithelium. Okay, and here are some important cells of stomachs are present. Parietal cells. Parietal cells secretes HCl. Zymogenic or chief cell, they secrete enzymes, and other lining cells, they are secreting mucus. Okay, and these are the gastric pits and gastric glands. Okay, so up to this will be the mucosa, lining epithelium, lamina propria, muscularis mucosa. Then here is the submucosa, then muscles, muscularis externa. Okay. In the submucosa, you will see sections of blood vessels. Okay, venule. This thin word is the venule. A thick word is the arteriole. Okay, and here are some adipocytes. Adipocytes or some other glands also present. Like this, you will see under the microscope. Simple columnar epithelium, gastric pits, and these are the gastric glands, muscularis mucosa, submucosa, muscle layer, and outermost is the serosa. Okay, muscle layers, muscles are oriented in different direction. You can see this is inner oblique or circular একসঙ্গে আছে, and these are the longitudinal. Okay. Next we are going to, so we have discussed cardiac end. Okay. Next we are going to fundic or body region of the stomach. A section of the stomach in the fundic or body region shows four layers: mucosa, submucosa, muscularis externa, serosa. Mucosa or fundic region or shows three layers: epithelium, lamina propria, muscularis externa. Lining epithelium, it is lined by simple columnar surface mucous cells, and these cells show presence of mucinogen granules in the apical part and basal oval nucleus. And in HE staining, surface mucous cells show vacuolated apical cytoplasm as mucus is removed during slide preparation. And in periodic acid shift staining, fast staining, this mucus takes deep magenta stain. This is a special stain for the mucus. And toluidine blue staining, blue colored glycoproteins of mucus is seen. Okay, this is another specific stain for the mucus. So here also all these layers will be present. Mucosa, lamina propria shows presence of simple branched tubular glands called the gastric or fundic glands. And the isthmus of the gastric gland has stem cells that divide and migrate towards gastric pit and towards the gastric gland. Each gastric gland has a neck segment and fundic segment or base. And gastric glands are lined by mucous neck cells, chip cells, parietal or oxyntic cells, enteroendocrine cells, and some undifferentiated cells. And other layers will be same as other previous. The structure of muscularis mucosa, submucosa, and muscle layer serosa in the fundic or body region of stomach are same as that of the cardiac region of the stomach. Okay. So, like this, you have to draw a diagram. This is the lining epithelium, columnar epithelium with basal nucleus. These violet dots are the nucleus, and these are the gastric glands. Okay, gastric pits, and they are opening into the gastric pits. And these glands are containing different types of cells. These are also sections of glands. Some lymphatic follicle is present. Here is the lamina propria. This is muscularis mucosa, inner circular, outer longitudinal. Here is the serosa, containing sections of blood vessels, nerves like this. And these are the muscularis externa. Three layers: inner oblique, middle circular, outer longitudinal, outermost serosa. Okay. Okay, so this is in cardiac region, you will see the gastroesophageal junction. Okay, here you are not seeing this. Glands are more elongated. See, these are the fundic glands containing different cells. Okay, like this you will see the fundus or body under the microscope. Epithelium, gastric pits, gastric glands. After that, other layers: muscularis mucosa, submucosa, muscularis externa, like this. So this diagram we have to draw for your histology copy. To take picture of this, this is for fundus and body of the stomach. The large pink cells, they are the parietal cells. Other cells are the chief or peptic cells, and these are parts lining epithelium of the glands. And other columnar cells will secrete the mucus. Okay. So and these are the lamina propria, muscularis mucosa. Total they form the mucosa. This is the submucosa containing sections of blood vessels, nerves, and these are the muscularis externa, inner oblique, middle circular, outer longitudinal smooth muscle layer, and here is the serosa containing some sections of blood vessels and connective tissue. Okay, understood? Like this you will draw, and you must draw nucleus. In your senior's copy there is no nucleus. Every diagram of the GIT you have to draw proper epithelium and nucleus. Okay, understood everyone? And this is mucosa of fundus and body. This is picture from the histology atlas. It looks like this. Okay, we have discussed already. These are the gastric pits, gastric glands, parietal cells, chip cells, mucin secreting cells, some lymphatic nodule, muscularis mucosa, submucosa. Okay, sections of arteriole, venules. Different types of cells, gastric pits, mucosa. These are the oxyntic cells or parietal cells. C is the chip cells. Oxyntic cells is taking more pink in color, and this is more blue in color, chip cells. Okay. Here also you seeing same thing. Parietal cells, chip cells, fundus and body region. And see here the muscle layers are prominent, inner oblique, middle circular, outer longitudinal, and serosa. This part is the submucosa, and this is the mucosa. Okay, lining epithelium, lamina propria, and in the lamina propria you are getting sections of glands and muscularis mucosa. Like this you will see under high power microscope. Pink one are the sections of the parietal cell, and deep colored one as the chip cells or zymogen cells. Okay. Within the lamina propria, lining epithelium, these are the columnar epithelium forming gastric pits, muscularis mucosa, submucosa. Enlarged view of this chip cell and parietal cell. These are the parietal cell staining pink or reddish, and these are the chip cells. Tester chip cell is, these are the chip cells. Chip cells or zymogenic cells. Okay. These are the columnar epithelium with basally placed elongated nucleus. Like this you have to draw. Okay. This is basal region of gastric fundus mucosa. Sections of glands and muscularis mucosa have been seen clearly. This is a circular layer, longitudinal layer. Okay. After that, here is the submucosa. These are the gastric glands, parietal cells, and chip cells. Okay, so these are the, like this you will see under low power microscope. Okay, here we are seeing only low power microscope, so you will see like this. This is also seen in high power microscope. These are the mucosa, 3 layers of the mucosa, muscularis mucosa, lamina propria, lining epithelium. Here is the submucosa. These are muscularis externa, outermost is serosa. Okay. So this is the summarization of fundus or body of stomach. Mucosa have these 3 layers. Epithelium is lined by surface mucous cells and short gastric pits. Lamina propria has long gastric glands. Muscularis mucosa has inner circular, outer longitudinal layer. And these are the cells of gastric gland and their function. Mucus-like cells, they secrete visible mucus. Oxyntic or parietal cells, their stains pink, secrete the HCl and intrinsic factor. These secretions are important for your Viva and MCQ. Okay, which cell is secreting which cell? Chief or zymogen cells, they secrete the pepsinogen. Enteroendocrine cells, they secrete gastrin, serotonin, histamine. Stem cells, they divide and replace the other cells. And other layers are the submucosa, muscularis externa, serosa. Okay. Okay, cells of fundic glands of the stomach. The fundus or body of stomach has branched tubular glands. These are the type of glands. And they have mucous-like cells, chip cells, parietal or oxyntic cells, enteroendocrine cells, and some undifferentiated stem cells. Okay, so we will discuss these cells So first is mucous neck cells located in the neck region of Fundic glands just beneath the gastric pits. They are columnar cells with basal oval nucleus. Cytoplasm shows apical mucinogen granules which have foamy appearance on HE staining, and these cells produce soluble mucus. Surface mucus cells produce insoluble or cloudy mucus. Some mucous neck cells give rise to stem cells in the neck region of gland that later replace the surface mucus cells, and the mucus cells are repressed every 5 to 7 days. Next is chip cell or zymogenic cells. These are blue in color on HE staining and also called cryptic cells, and these are located in the deeper or basal part, that is lower 1/3 of the gastric glands, in the fundic and body part of the stomach, and these cells synthesize proteins, pepsinogen. Hence their cytoplasm contains a large quantity of rough endoplasmic reticulum, and this rough endoplasmic reticulum takes basophilic or blue or hematoxylin stain in the basal part of the cell, that is basal basophilia. Okay, this is identification point. Next is apical portion of the cells have secretory zymogen granules, and that infers slightly apical eosinophilia. And function, it secretes pepsinogen. Function you must remember. Okay, chip cell secrete pepsinogen, parietal cell secretes HCl, an intrinsic factor. So parietal cell or oxyntic cells, they are mostly found in the upper part and neck region of the gastric glands in the fundus and body part of the stomach. They are large triangular cells with a spherical nucleus, and the apex of the cell is directed towards the lumen of the gland and the base towards the basal lamina. And in HE staining, the cells stack dark acidic or pink stain. As they stain strongly with eosin, they are called Oxyntic cells. And under electron microscopy, the parietal cells have a intracellular canalicular system and tubule vesicular membrane system. Apical cell membrane shows several invaginations that form the intracellular canaliculi. The wall of canaliculi shows a number of small microvilli, and the cytoplasm contains numerous mitochondria. Immunohistochemistry, the wall of canaliculi contains a number of protons, H plus pumps and C minus pumps, and these pumps helps in the secretion of HCl. Okay, so Cl হবে Cl, chlorine pump or proton pump. আর এটা হচ্ছে function is parietal cell secrete HCl and intrinsic factor. And intrinsic, what is the function of intrinsic factor? It binds with vitamin B12 and helps in its absorption. And deficiency of intrinsic factor leads to vitamin B12 deficiency and pernicious anemia. Okay, that's why during removal of stomach due to some reason there will be B12 deficiency, and you have to supplement B12 from outside. Okay. This is ultrastructure, some features of electron microscopic structure of oxyntic cell or parietal cell. Okay, so intracellular cleft with microvilli, nucleus, mitochondria, and granular endoplasmic reticular triangular cells with some microvilli. Okay. So parietal or oxyntic cell, they have a lifespan of 150 to 200 days, and parietal cells have gastrin receptors, histamine receptors, and acetylcholine receptors. These hormones further control HCl secretion. Okay. Next, there is another cell is enteroendocrine cell. These cells are mostly present in the lower portion of the gastric glands, and they are again of two types: closed type, open type. In HE staining, the cells remain unstained on HE staining, hence difficult to identify. And on silver staining, cells are argentaphine or argyrophilic cells stained by silver salts. Function is secretion of gastrin, serotonin, histamine directly into the blood vessels. Stem cells, some undifferentiated stem cells are present in the neck region of the gastric glands, and these cells divide and move upward and downward to replace the other cells. See here, this is parietal cell, this is chip cell. Chip cell, you will see zymogen granules, okay, and basal nucleus. Here is the enteroendocrine cell, closed type. Okay. Endocrine cell, so it is secreting its secretion into the blood towards the vessel side. Okay. And for these two, secretion will come out through the apical portion. Okay. So these are the difference between all the cells. So mucous neck cells, neck of the gland, columnar cell with oval nucleus, secrete soluble mucus, lifespan is 6 days. They are continuously replaced. Okay. Chief cell or zymogen cells, lower third of the gland, dark basophilic cytoplasm, pepsinogen secretion, and 150 to 200 days. This lifespan is highest. Okay. Chief cell or zymogen cell. Parietal or oxyntic cells, they are located in the upper part of the gland. They have a dark acidophilic cytoplasm, secrete HCl and intrinsic factor, lifespan is 60 to 90 days. And enteroendocrine cells, they are located in lower part of gland in silver staining. They are argyrophilic cells. Okay, and they secrete the gastrin, serotonin, histamine like these hormones. Okay. And adult stem cells are there located in the neck region of the gland, can be identified by immunohistochemistry. They divide and migrate upward and downward. Okay. So surface mucous cells have a lifespan of 3 to 5 days. Okay, so all the lifespan has been given. Okay, next we are going to pyloric region. So you have discussed the fundic, cardiac end, fundus and body, and then we are going to pyloric end. A section of stomach in the pyloric region shows again those 4 layers. Mucosa of the pyloric region shows 3 layers: lining epithelium, lamina propria, muscularis mucosa, surface epithelium lined by tall columnar surface mucous cells. Lamina propria shows presence of pyloric glands. Gastric pits of the pyloric region are deep and occupy about 2/3 thickness of the mucosa. And pyloric glands are shorter than the gastric glands. Okay, fundic glands than the fundic glands, and glands occupy only lower half or 1/3 of the lower 1/3 of the mucosa. Pyloric glands are coiled branch tubular glands with wider lumen than the fundic glands, and pyloric glands are lined by only one type of cells that are similar to the mucous neck cells. Okay, and these cells produce mucus. The muscularis mucosa, lamina propria, submucosa in the pyloric region are same as the cardiac end, and smooth muscle cells have a thicker circular muscle core that forms the pyloric sphincter. That is the difference. Okay, circular muscle layer is thickened to form the pyloric sphincter. Okay. Next is serosa. Stomach is covered by a connective tissue layer with mesothelial lining of the visceral peritoneum. So this is summarization of pylorus of stomach. Mucosa 3 layers, other layers are same: submucosa, muscularis, externa, serosa. Epithelium is lined by surface mucous cells and long gastric pits. And these gastric pits are long here and glands are shorter. And for fundus and body, gastric pit are shorter but glands are longer. Okay. And here lamina propria contains short pyloric glands lined by mucus-secreting cells. And muscularis mucosa have these 2 layers, inner circular, outer longitudinal. Inner circular layer is thickened to form the sphincter. Circular smooth muscle fiber in muscularis externa form the pyloric sphincter. See here, this is section through the pyloric region. See, the gastric pits are longer here. These are the gastric pits. Lining epithelium is tall columnar epithelium, and these are the glands occupying only lower 1/3 to half. Okay, and previously we have seen up to this level glands were extending. Okay, lower 2/3 almost. So, and this is one lymphatic nodule, muscularis mucosa. Here is the submucosa. Okay. This is histological picture. So, longer gastric pits, shorter glands, occupying lower 1/3 only, muscularis mucosa, submucosa. Here you see sections of blood vessels, adipocytes, In lamina propria also these are sections of blood vessels and some smooth muscle cells of the muscularis mucosa. Okay, so pylorus, you draw this diagram. Okay, you take picture of this and you draw this one. Longer gastric pits, smaller gastric glands. These are muscularis mucosa, submucosa, inner oblique, middle circular, outer longitudinal, and here is the serosa, sections of blood vessels. Okay, so like this you will see under the microscope. Longer gastric pits, smaller glands, muscularis mucosa, submucosa, muscle layer, and further deeper plane you will see the serosa. The schematic presentation, longer pits and shorter glands. Okay, so we are going to some clinical aspects of the stomach. First is gastritis. The term gastritis is commonly employed for any clinical condition with upper abdominal discomfort like indigestion or dyspepsia, in which the specific clinical signs and radiological abnormalities are absent, and the condition is of great importance due to its relationship with peptic ulcer and gastric cancer. Next is gastric ulcer. Gastric ulcer may occur due to damage to the gastric mucosal barrier, and it is most common along the lesser curvature and pyloric antrum. Food pain pattern will be there. Vomiting, significant weight loss, deep tenderness in the midline in the epigastrium are the main presentations. Okay. If you take food, there will be pain in case of gastric ulcer. But in case of duodenal and duodenal ulcer, there will be craving of food. Taking of food will relieve the pain in case of duodenal ulcer. Okay. So if it is here the mucosal barrier is damaged in the gastric region. So if you take food, it will cause pain there, and in that case, in after taking food, it gets some time. It will protect from the, and there is secretion of mucus from the stomach. It will go to the duodenum and protect the ulcer. So, if you take food, there will be increased secretion of the mucus. So, there will be more protection for the duodenal ulcer. And pernicious anemia, it occurs due to deficiency of intrinsic factor, okay, secreted by parietal cells, and intrinsic factors bind with vitamin B12, help in its absorption. Deficiency of intrinsic factor will lead to B12 deficiency and pernicious anemia. Okay, you will read different types of anemia during pathology. And okay, so these are the difference between fundic or body of stomach and pyloric region. Gastric pits are shallow here. It is deeper, occupy about 2/3 thickness of mucosa in pyloric region. Glands are here. It will be deeper. Glands will be deeper and it will be shallower in pyloric region. Coiling of the base. Glands are less coiled. Here it is more coiled. Glands lumens are narrow and it is wider. Cells present in the glands are the parietal cell, chip cell, mucous neck cell, and here mostly one type, mucus-secreting cell, chip cells are absent. Okay, in the pyloric region. On the upper left, you will see the lumen of the stomach. Then you will see the mucosa. Okay, mucosa is, you can see the lining epithelium, tall columnar epithelium. Then from there, invaginations are there. Invaginations are the gastric pits. Okay, pits are not of, it is, depth is less, so it will be mainly fundus or body region, and there will be some sections of glands in the lamina propria. After that, muscularis mucosa, submucosa you can separately differentiate. Then the muscle layer is starting. Okay, you see this. See the epithelium, gastric pits, gastric glands. Here the parietal cells, chip cells are prominently seen. Some deep pink cells are present. Those are parietal cells. Others are some chip cells, mucous neck cells, and you can see the muscle layer. then the serosa. The thin flattened epithelium, that is mesothelium. Okay, this is a peritoneal covering. So on the upper side there is the lumen and lower side peritoneal covering or serosa. This is mainly pyloric part. Gastric pits are deeper, our glands are occupying only 1/3. Okay, then muscularis. Mucosa, you will see submucosa. In submucosa, sections of venules and arterioles are clearly seen here. And after that, muscle layer is starting. Okay, innermost oblique, circular, longitudinal. If you shift the view field, then you will see other. Pyloric end, you are seeing deeper gastric pits almost occupying 2/3 of mucosa and 1/3 is occupied by the gland. Then muscularis mucosa, submucosa, muscle layer and serosa.